Hello, good evening. This is Dr.Bibaswan from SIMS Shimoga, Karnataka, and we are back with the remaining 20 cases. This is meant to be just a brief run through so that you know what are the main points to diagnose each case. The detailed videos on each case will be shared later. So, for case number 21, there were some cases. This case number 21 and 22 were on the acid-base disturbances. So, case 21 was there was low pH and there was increased partial pressure of carbon dioxide, and there was the history of respiratory depression. If you see these three, low pH, that means it is acidosis. Partial pressure of carbon dioxide is increased, that means something to do with respiratory. So, and also respiratory depression. So now just combine all the three. Acidosis plus respiratory, so we get respiratory acidosis. Simple. One easy way for diagnosing acid-base disturbances is to follow the tic-tac-toe method. So the pH is going down and the PCO2 is going up, then it is respiratory acidosis. If the pH is going down and the bicarbonate is going down, then it is metabolic acidosis. If the pH is going up and the carbon dioxide is going down, then it is respiratory alkalosis. If the pH is going up and the bicarbonate is going up, then it is metabolic alkalosis. Whatever other finding you find, apart from this, that will be the compensation or the no compensation. If you see in a case of respiratory acidosis that the bicarbonate is normal, then you know that there is no compensation. So it is respiratory acidosis without compensation. If you see in a case of respiratory acidosis that the bicarbonate level is rising, then you can understand that the body is trying to do something, the body is trying to fight back. Then you can say that there is some compensation. There is respiratory acidosis with compensatory metabolic compensation, or rather with compensatory metabolic alkalosis. It is very simple. So cases number 21 and 22 were on this. We move on to the next ones. So there was this case on vitamin. There were actually quite a few cases on vitamins. Vitamins, if you have the history of inability to read in poor light and grayish white spots on the conjunctiva, Bitot spot, straight cut diagnosis, vitamin A deficiency, xerophthalmia. And those dry spots in the eye, those are called Bitot spots. Next, there was a case on vitamin B3 deficiency, niacin deficiency. This is very easy. We know the famous mnemonic of D3. Diarrhea, dermatitis, dementia. That's it. Diarrhea, dementia, dermatitis, if you have these three, you can straight away say that it's a case of pellagra. The vitamin which is deficient is niacin, vitamin B3, and the disease being caused is pellagra. So, dermatitis may be written in some different ways, like it might be written like increased pigmentation or bright reddish patches on the neck They might describe it in different ways. But you know, however way, if it is describing dermatitis, then use the D3 mnemonic, diarrhea, dementia, dermatitis. And if untreated, subsequently it will become D4, death. We hope that doesn't happen. And also, the ring that is formed in these pellagra cases is known as Casel's necklace. Casel's necklace. Moving on. There was this case on vitamin C deficiency. Very, very famous. All of you have read it for your theory exams. So, bleeding gums, petechiae, swollen and painful joints. So giveaway, scurvy, straight away. Ascorbic acid deficiency. Ascorbic acid means vitamin C. And why it is happening? Due to the defective collagen. There is defective hydroxylation of the residues, and hence we have weak collagen, and hence all the manifestations. That has already been covered in the theory. No need to go in depth. Then case number 26, that was an image-based question where there was shown the photo of a boy with the legs in this position and the chest very prominent in the rachitic rosary type of picture. Bowing knees, rachitic rosary, small boy. Easy, vitamin D deficiency, rickets. So those watching this video from SIMS, there is only one image-based question out of all the 40 questions. If you see the image, you instantly know it is rickets. So it's a child, so it is rickets. If we had vitamin D deficiency in the adults, that would give rise to osteomalacia. I believe it was asked even in your theory paper, I think. Next question, 27, 28, 29, 30. There was a question, this was on iron deficiency anemia. Female, weakness, fatigue, heavy menstrual bleed, low hemoglobin levels. She was found to be anemic. Instantly close your eyes. This is a case of iron deficiency anemia. This can't be anything else. At times, iron deficiency symptoms are clubbed with vitamin C deficiency symptoms in certain previous year's questions of the RGOHs. That's important to note. If you're having bleeding gums and all together with the anemia, then the main problem is vitamin C deficiency, scurvy. So it is scurvy with anemia. So the scurvy is primary, the anemia is secondary. But if you don't have all those bleeding gums and all symptoms, it's only about the anemia and the bleeding, but not necessarily from the gums. Menstrual bleeding or the history of a female. So then it becomes more prominent because females will have the menstrual bleeding and the anemia. This picture is more suggestive of iron deficiency anemia. Iron deficiency anemia is a very, very common condition in India and in fact all over the world. Next case. There was this case. This is Wilson's disease. This could be a blinder, but it will not be a blinder if you know. Look for the key points. Flapping tremor, which is also called asterixis, and blue colored ring at the sclerocorneal junction. Blue colored ring. Together with low serum ceruloplasmin, low serum copper, and increased urine copper. If you have these findings, you can say that it is a case of Wilson's disease. And then the examiner might ask, what is this blue ring, this fancy blue ring? It's a nice name, KF ring, Kaiser Fleischer ring, KAYSER dash FLEISCHER, Kaiser Fleischer ring, Wilson's disease. Then there were some other amino acid disorder cases as well. First we'll come to case number 29, which was apparently involving hypothyroidism. Nothing much is there. The case is mental retardation, stunted growth and neck swelling. Diagnosis is already given, hypothyroidism. You have been asked to say which mineral is involved. It's obviously iodine. Hypothyroidism, the mineral involved is iodine. And clinical manifestations, I believe you know that well. Yes. In children it will be cretinism, in adults it will be goiter. You can even make parallels with vitamin D deficiency in terms of like children separate, adults separate. Vitamin D, children rickets, adults osteomalacia. Iodine deficiency, children cretinism, adults goiter. Like that. If you want, you can make something here. And which is the amino acid involved? The amino acid involved is tyrosine. So it is linked with amino acid metabolism actually. Mineral metabolism linked with amino acid metabolism. Then there were some cases involving carbohydrate metabolism. We'll come to those. So case number 30 was involving the fructose to fructose 1-phosphate, that pathway, fructose metabolic pathway. It may be noted that there are two very important enzymes. The first step, fructose to fructose 1-phosphate, the enzyme is fructokinase. And the next step, that is fructose 1-phosphate to glyceraldehyde and dihydroxyacetone phosphate. This step needs aldolase B. If the first enzyme is deficient, fructokinase, then we have essential fructosuria. If the second enzyme is deficient, that is aldolase B, then we have hereditary fructose intolerance. The second case, that is hereditary fructose intolerance, has more of symptoms and manifestations. It is more serious. Next one, what was there? Next was galactose metabolism. Galactose metabolism, just like fructose, there are two enzymes involved here also. Galactose 1-phosphate. The enzyme involved is galactokinase. As you are adding phosphate, it becomes kinase. And then galactose 1-phosphate to UDP galactose. This is a very famous enzyme, galactose 1-phosphate uridyl transferase. Galactose 1-phosphate uridyl transferase. If the second enzyme is deficient, we have galactosemia. Galactosemia, it is a famous disorder which has been discussed a lot. They might ask about the symptoms of galactosemia. Vomiting, failure to thrive, hepatomegaly, very important is cataract. Because galactose will be converted to certain substances which will accumulate in the lens. Read the sugar alcohols part for that. Next, we move back to amino acid metabolism. Phenylketonuria. It's a cakewalk. Mentally retarded boy, high phenylalanine and high phenylacetate, phenylpyruvate, phenyllactate. If you get this, close your eyes. This is a case of phenylketonuria. So many phenyl. It is phenylketonuria. There is no other case like this in your 40 cases. Phenylketonuria, and the classical type is due to the deficiency of the enzyme phenylalanine hydroxylase. So what we have to do is, the treatment is reduce phenylalanine rich diet and increase tyrosine rich diet. Then if we talk about phenylketonuria, we cannot forget about alkaptonuria. Alkaptonuria, very easy. Diaper staining black. Diaper staining black. That one is self-classical, you can say. Alkaptonuria to homogentisate oxidase deficiency. Case number 34, that is Hartnupp's disease. What are the characteristic findings you want to see? On the presence of neutral amino acids in the urine. This is one key point. And also the history of pellagra-like symptoms. Pellagra-like, not pellagra, different. Pellagra-like symptoms. These two key points should be there. And they'll ask why pellagra-like? Because tryptophan is not being converted to acid. Hence, we are having the pellagra-like manifestations. Next question was number 35. Maple syrup urine disease. Easy one. Burnt sugar odor. See that one point, burnt sugar odor. That one point is there, you mention it as maple syrup urine disease. And they might ask that, why maple syrup urine disease? Which amino acids? The answer is branching amino acids, leucine, isoleucine, valine. Branching amino acids. These three. Next, 36, what was there? 36, very famous case. Multiple myeloma, celebrated and very much discussed case. Why to say multiple myeloma? First point, crush fracture of the vertebra with punched out lesions. Crush fracture, punched out skull lesions, monoclonal immunoglobulin in the serum electrophoresis, and K chain in the urine. K chain. This K chain is basically immunoglobulin related to a particular protein, famous protein, Bernstein's protein. These points if you have your diagnosis of multiple myeloma. Case number 37 and 38 are related to uric acid metabolism. So, high uric acid, pain in index finger, pain in great toe, straight cut diagnosis, gout. High uric acid with mental retardation, with self-mutilation, Leishman syndrome. So you can make it simple, like high uric acid without CNS manifestations, think of gout. High uric acid with CNS manifestations, think of Leishman syndrome. CNS manifestations, why? Because I'm saying mental retardation, self-destructive tendency to bite the fingers and lip, tendency to bite, Leishman syndrome. It's done. Next is 3940. 39 was about Parkinson's disease. They've already given the diagnosis in the question, in fact, and they've asked what is the deficiency. Symptoms of Parkinson's disease: tremor, pill rolling movement, and what is deficient? Dopamine producing cells. Dopamine producing cells are deficient. Simple. And we are treating it by giving levodopa. They might ask about the pathway. which is the amino acid involved. It is tyrosine. So how tyrosine is converted to dopa and how dopa is converted to dopamine and which are the enzymes involved, you should know. There are certain points about the enzyme inhibition as well with regard to dopa decarboxylase. That's important. And finally to the last case of our 40 cases, lactose intolerance. Simple one. Development of diarrhea after taking milk. Milk is the milk because milk contains lactose. So development of diarrhea after taking milk together with abdominal pain, bloating, whatever. Diagnosis is lactose intolerance. That milk itself is the development of diarrhea after taking milk. Lactose intolerance. Deficiency of lactase. So got to cut down on milk in the diet. Reduce milk in the diet. Milk and milk-based products. Very common this condition. That completes the 40 cases. And thank you very much for your patient hearing. We'll try to make individual videos of the separate cases. I was planning to make it now itself before the exams, but it seems that we're getting very long. My apologies, I could not do that right now. I'll be doing it shortly. And all the best for your examinations and hope you pass and do well. Get through with flying colors. Good luck. Stay tuned.